Depression, otherwise known as major depressive disorder or clinical depression, is a common and serious mood disorder. This mental illness affects a very large portion of our population, but there are still many misconceptions about depression today. This video is not meant to diagnose or replace advice from a healthcare professional. Please consult the appropriate healthcare professional regarding your mental health concerns.
Hi, I'm Alex. I'm age 23.
My name is Aya Al-Rafia, and I'm 21 years old.
I'm Shelly, and I'm 21 years old.
I would define it as a feeling of being upset and having constant feeling of anxiety, feeling of loneliness, and maybe feeling like you're not a part of something, or maybe you're missing something.
I know depression is a mental health disorder, and it usually comes with an individual feeling down or worthless. I think that you can have long-term depression, or you can have short-term where it comes in spurts over time. So yeah, I do think that depression does have a person in a negative headspace.
Depression is a mental illness that affects people's mood and causes them to feel very sad or upset for prolonged periods of time.
Depression is a mood disorder that causes persistent and constant sadness. It is the person's lack of interest in life. With a lack of interest in life, some patients isolate themselves from society and can have suicidal thoughts. It's normal to experience sadness, however, intense sadness is cause for concern. Some symptoms of depression include body aches and pains, feeling empty, sad, worthless, and helpless, anger and irritability, insomnia, suicidal thoughts, fatigue, and excessive guilt. The severity of these symptoms varies for every individual, but usually symptoms last more than 2 weeks for clinical depression. This mood disorder could last for weeks, months, or years.
Maybe sense of loneliness, sense of not having maybe family or friends around. It could be due to certain factors like economic factors, maybe not having a job, not having money, not having friends. Maybe there's something that's missing that someone's looking for in life and they feel like they can't have it.
I think there are a variety of factors that could cause depression. I think loneliness, and sometimes I think that depression is associated with being introverted, but that's not always the case. I think when an individual is feeling down or lonely or almost in a funk and they feel like they can't get out of it.
I think maybe going through a traumatic event or a big change in life, or just feeling very lonely and isolated, can lead to depression.
Depression is caused by a variety of factors, including environmental factors, social factors, psychological factors, and biological factors. Environmental factors include traumatic events, drug and alcohol abuse, overwork, stress, poor diet, lack of exercise, sleep, and leisure time. Biological factors include genetic composition, family history, changes in the brain's neurotransmitter levels, and hormone imbalance. Social factors include isolation from society, and psychological factors include the person's outlook on life.
I wouldn't say there is one cure or treatment specifically for depression, but maybe it could be a number of things that you can try together, like counseling, like being open about the conversation about depression, stuff like that.
I don't know if this mental illness can be treated, but I do think that there are support systems that can come into play, and they play a key role. Like, for example, friends and family. They can almost uplift the mood, get this person to feel out of this funk that they feel like they're in, almost change their headspace in a way.
People can take antidepressants to treat their depression. I also hear that sometimes it just kind of goes away on its own.
Treatments for depression vary, with availability ranging from community-derived services to physician-prescribed treatments. Depression is a psychological, social, and biological condition. Thinking happy thoughts, while it may be a common practice in some therapeutic techniques, such as cognitive behavioral therapy, is not by means a universal solution. Thinking positively doesn't work for everyone. Sometimes one type of treatment successfully manages symptoms, other times a combination of treatments work best. It is common to combine medical treatments and lifestyle changes. Your healthcare provider may prescribe medications such as antidepressants, anti-anxiety, or other types of mood stabilizers. They may also recommend or refer you to see a licensed psychotherapist or psychologist, either in conjunction with or as an alternative to pharmacological treatment. Psychiatry may also be an option, but that is saved for more severe cases such as major depressive disorder. Community services such as community counseling and therapy, mental health support groups, and telehealth programs may be a more accessible and affordable option for some, although there is still a long way to go in improving community resources for mental health. Complementary and alternative treatments may also be an option. Such interventions are less widely used but are still supported by the evidence, including herbal supplements, music therapy, acupuncture, and meditation.
I would say it affects a larger amount of the population than we actually realize, just because people are not as open and honest about depression. I think maybe it would affect maybe 1 in 4 people. Maybe 25% of the population is being affected by depression.
I think depression impacts a large part of the population, but I do think that the word depression is thrown around quite loosely. People say that they're depressed when they may not have the symptoms of the mental health disorder. But I do think that a large part of the population does go through this mental health disorder.
I'm actually not sure about that. I imagine it's a lot of people, but personally, I don't know anyone that has it.
Mental illness is a leading cause of disability in Canada. 2.8 million Canadians suffered from a mood disorder in 2019. 70% of mental illness in Canadians have their onset during childhood or adolescence, and 11 suicides occur daily on average in Canada. With these shocking numbers, you may not know if someone is depressed because they can hide their symptoms. Please observe your loved ones, be supportive, and always treat people with kindness.
Everything you know is in your mind.
Teens, maybe ages 14 to maybe 25, and then I also think it could affect adults as well, like any age really from 30 to 50, or maybe even older, 60, 70.
A population that I think it affects the most is probably seniors, just because most of them are lonely, whether they're living with other people or themselves, especially ones that live in senior homes. So I do think that the population of seniors is probably one of the ones that are up there.
Maybe people that have undergone a traumatic event in their lives, or people that feel very lonely and isolated, don't have a lot of family or friends or a strong support system.
Depression does not discriminate against age, gender, or personality, and can affect anyone from any age group and any walk of life. Men and women are both diagnosed with depression equally, but the symptoms and characteristics can be much different. Because of this, men are commonly and easily misdiagnosed. And with that being said, the female to male diagnosis ratio in Canada is 2 to 1. The stigma surrounding mental health is very much alive in our society today. Take the time to educate yourself and be a part of the change to end the stigma.